Welcome to the Natural Doctors, where we bring medicine back to its roots and help you take your health into your own hands.
We're here to explore what it means to heal naturally, intentionally, and with wisdom that bridges science and spirit. As a reminder, the content presented in this program is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. The views and opinions expressed are those of the individual practitioners and guests and don't necessarily reflect the official policies or positions of any medical board or regulatory authority.
So hi everyone, welcome to the very first episode of the Natural Doctors. I'm Dr. Jen Stagg.
And I'm Dr. Katie Dinello. We're both practicing naturopathic physicians and we're so happy to be here with you today.
This show is born from a shared calling to speak loudly and compassionately about where medicine is going and how we can reclaim what was never truly lost.
Yeah, we've spent years treating patients, researching, studying, and now we're really excited to bring all of that knowledge to you today.
This really is a turning point in history, we feel, and natural medicine is really rising, and it's not just an alternative, but it's a vital part of where health is headed.
And if you're wondering what naturopathic medicine even is, it's a really beautiful form of medicine that blends science with ancient healing and wisdom. We look at the whole person, not just the disease, but we really try to understand the root cause and understand what can prevent diseases.
We use tools like nutrition, herbal medicine, mind-body therapies, physical medicine, lifestyle guidance. But what makes it different, what naturopathic doctors do, is the philosophy. So we treat the whole person and we remove obstacles to healing. That's what we term. And we really trust in that healing power of the body's wisdom.
And some people come to naturopathic medicine because they've exhausted all of their other options. They've seen the specialists. They're still not getting better. But some people actually just want to start with naturopathic medicine from the start. But either way, what we offer patients is empowerment in their own medicine and healing journey.
We're really here to help people realize that healing is possible, that it doesn't have to be mysterious or sort of out of reach. You could take your health into your own hands with the right guidance, support, and knowledge. So, Dr. Katie, tell us a little bit more about how naturopathic doctors are trained.
Yeah, so just like an osteopathic doctor, for example, or a podiatrist who go to specialized medical schools, we also went to a special medical school called Bastyr University out in Washington State. And what's great about this medicine is that, like conventional doctors, we have a 4-year medical degree. So we study physiology, anatomy, biochemistry, the hard stuff, right? But then what's really cool is we get to also study homeopathy, nutrition, plant medicine, physical medicine, and really what's important is that spiritual aspect of medicine, energetic healing, which we both really love. So it's a really nice blend of both modern science and kind of ancient healing and wisdom.
Yeah. So we should probably just first all sort of discuss what led us to this field, right? So I could start.
Yeah, you go first.
So I really started out like as, a young person. I was really interested in nature. I spent a lot of time outside in my childhood. I was always really interested in like why. I always asked my family why. I wanted to know. So, like later on in life, we're going to talk a lot about root cause medicine and how naturopaths are all about the why. But I was also really interested in science and math. So, I really went sort of academically on that track for a while, right? Yeah. So I was, did a degree in biochemistry. Then I went actually into a PhD program in biochemistry.
Overachiever over here.
Yeah. And then I thought like, I didn't really want to be in a lab for the rest of my life. Then I thought, okay, I'll go to medical school. So maybe I can help there because I didn't even know what naturopathic medicine was.
Same.
Yep. And so then I discovered like in the Career Planning Center, this brochure on naturopathic medicine at Bastyr University.
Right? What's that all about?
And I was like, oh my God, this is perfect. So off I went to Bastyr. I didn't even apply to any other schools. And like, I still believe it was like perfect. And also Bastyr is a really, founded on, on foundational principles, really naturopathic, at its core, but it also has a very like science-based program and a research institute. And so I worked in that while I was there. So, it's interesting, like, where your life leads. But now looking back, I can see how like all the little like clues were sort of there.
They were there.
Yeah. So how about you?
Yeah. What I love most about your story, Jen, is that you loved playing outside so much, right? Like in Canada, for those of you who don't know, that's where she was playing outside. But, right. And just how being playful as a kid is what, ultimately was a huge piece of leading you into that medicine.
Yeah.
So, so a couple years later, I was at Bastyr. And I grew up in Connecticut, and I went to UConn. I studied nutrition. I really thought I was going to be a conventional doctor. I loved the adrenaline of the ER. I was an EMT for a while and thought, oh gosh, I'll just, go be an ER physician. But at the same time was really studying nutrition and learning about how food impacts our health, right?
Yeah.
So after college, took some time off, took the MCATs, and was starting to apply to UConn Med School. And I had
like I did that too. Like
exactly.
I was at the University of Iowa taking the MCAT.
Right, because we think, as healers,
didn't know any different, like, that there was other options.
Right, like there was no show like this to tell us, hey, this is, naturopathic medicine exists. So, I found myself with really debilitating stomach aches, actually, every single day. And I remember I was working at a federally qualified health center in Middletown, actually, and, still working with doctors there and kind of going the conventional route. And I was bent over my desk one day in so much stomach pain. And my boss said, that is not normal. You have to go see her naturopathic doctor. And I said, what is that? Who is that? And so long story short, I went and saw her, and she was amazing. And of course, fixed all of my gut issues. And then helped with my anxiety while taking the MCATs. And one day I was in her office and she said, it's just kind of ironic that you're coming to see me, right? And you're applying to conventional medical school. Have you heard of Bastyr University? And so flew out to Washington and said, oh gosh, like this is what I've been looking for. This is it. And, to this day, it's been the best decision, right? Like we have such amazing careers and we get to heal people in a true way that feels really authentic. And here we are.
Oh my gosh, that's so great. That's wonderful.
All right, so we are going to kind of turn the tides here, and we're going to talk about healthcare, kind of the status of where healthcare is and how our medicine fits into that. So let's face it, our healthcare system is currently really overwhelmed. It's expensive, it's reactive, right? It misses the bigger picture. It was designed for acute care and it can't handle the chronic conditions that millions of people are living with every single day. So we have really become conditioned to think that the medical solution lies in a prescription, a surgery, seeing a specialist, right? But it's so much more than just suppressing symptoms, right? It really is about the root cause. Now, this word reactive, it really resonates with me. And that's what our conventional system is designed around. But naturopathic medicine offers something different. So Dr. Jen, tell us a little bit about how, we take a different perspective. We're not so reactive. We're more preventative.
Yeah. So it's really interesting. Like the way we think about symptoms when patients come in, a lot of times like patients are like, they just want whatever, symptom they're having, like they just want this to go away, right? So say like stomach pain. It's like, first of all, you need to figure out what that is, of course. And like certain times you need conventional like intervention. Sure. But a lot of these sort of like vague symptoms that people are having are really clues. It's your body's like mechanism. It's innate mechanism to say like something is off here. Yeah. And a lot of the patients that end up in our practices, of course, like we have people obviously that like know naturopathic medicine. They were raised with naturopathic medicine, but a lot of patients that come to us have been to their primary care providers. They've been to multiple specialists, and they're coming in with these sort of just like vague symptoms. And it's like, well, I don't know what's wrong with me. Right. And so this is where naturopathic medicine shines. So we like look at all of these symptoms and these different systems, and then we're sort of like looking at, well, what story is that telling? Right. And looking at the timeline of when those things started happening. And a lot of people, you know, we see a lot of the, you know, pretty well, like a lot of patients that are quite well, and they have just like maybe some minor things going on. But this is a really great place to like work on optimal health and prevention. So those really like early mild symptoms that are just like dismissed often don't become a big problem.
Exactly.
Right?
Yeah. Because we're catching them right before they actually become a big problem.
Yeah.
Now, part of that, it plays into what naturopathic medicine calls our obstacles to cure. So by removing these obstacles to cure, right, we can allow our body to heal better. Can you expand on what that means a little bit?
Yeah, so that's one of those like core principles of naturopathic medicine. And what we're trying to figure out for people is, well, you know, like what's keeping your body from being healthy? So that like there are big categories, and people are like aware of what these are. It just gives us a framework to work in. So like obviously one of the biggest ones is diet, right?
Absolutely.
So people are coming in, they're eating processed foods, and maybe they're not eating a ton of processed foods, but like processed foods are bad for your microbiome. They're terrible for your microbiome. And what someone thinks is like not that much could be enough that it's like causing a problem. And even when we, you know, give them probiotics or we give them specialized fibers, it might not be enough, right? So they can't get fully better because we're not removing that obstacle. Another big one we run into is stress, right?
Oh my gosh.
Huge. You know, this is like, you know, there's statistics out there on like how many office visits to medical providers are the result of stress, right? So this is something we have really good tools for in naturopathic medicine, but it really is something that needs to be addressed like early in that relationship so that patients have this better trajectory, like they can actually heal better. Like that's often what I call like the elephant in the room. Right?
Exactly.
So people are coming in and they're actually eating really well, then they're exercising, and you know, they're doing all the right like lifestyle things and avoiding environmental chemicals. That's another big aspect that we think about.
Oh my gosh.
And so then we need to work on that as well, right? So we got to like get them in a better place, and there are a lot of tools, and I'm sure we'll talk about this in future episodes in depth.
Yeah, exactly. I know. I love what you're saying, right? It's this idea that we don't necessarily have to add in all these things. We don't need to add in fancy supplements all the time, right? Sometimes it's really about evaluating that person's lifestyle and saying, what are some things we can remove and take away here so we can encourage your body to heal without these obstacles in the way. So,
Absolutely.
I love that. And you know, when we get really quiet and we think about where healing starts, we all know deep down, right, that it starts in the kitchen. It starts with our sleep. It starts with movement, right? All of these, what we call foundations of health. Can you talk a little bit more about those?
Yeah, so these are things kind of like a little bit, you know, another step, this kind of like basically the other end of the spectrum. So we have to remove those obstacles to cure, and now we work on foundations of health. And so you're right, like people can find, you know, 10, 15 supplements that they could take for any specific set of symptoms. And people are using they're using ChatGPT. They're saying, I have these symptoms, what should I take?
Tell me the supplements.
Right, exactly. But, you know, bigger picture is, well, what are you eating, right? Like, what does your diet look like? Let's look at that first before we just like start adding supplements on. And sometimes like there are certain supplements that can like, you can take like initially, but you can't undo a poor diet by just taking supplements, right?
I always tell my patients, the supplements are often a drop in the bucket when you're not sleeping well, when you're not eating well, right? When you're not doing breath work, meditation, right? Really listening to your body. supplements they can be Band-Aids. They can be very helpful, and we'll talk all about them, right? But
yeah, but so like an example there would be that I'm thinking of is sleep, right?
Yeah.
So that's something that we always like address really early on, because we're like, okay, you're not going to be able to like get where you need to get to if you're not sleeping.
Yeah.
And so there's somewhere where, we, tell them all, sleep hygiene practices, sleep in a dark room, don't go on your phone at night.
Yeah.
But sometimes that's not enough, right? And so early on that there might be, an herbal formulation that I would recommend for someone, or melatonin, or, really looking. Also, another thing obviously that sets us apart is this concept of personalized medicine.
Yes,
so
absolutely.
like, it's not just like everybody goes on this one supplement for sleep. It's really seeing what stage of life they're in, what type of sleep problems they're having, and then we might recommend something like that for sleep. But that's a big thing. I'm sure, you see that a lot with your patients.
I see it all the time, right? And sleep is such a perfect example of personalized medicine, because it is definitely not a one size fits all approach, right? People are not sleeping for so many different reasons, and it takes really getting to know the patient, really asking those tough questions, right? It can be vulnerable when we talk about sleep, right?
Yeah.
That time period from when you get home from work until you go to bed, there's a lot going on, and it can be personal. So that's a perfect example of how we have to ask those deeper questions and do those foundational pieces before we go for the supplements.
Yeah.
Okay, great. I think one other thing that we should touch on here is this naturopathic principle called the vital force. This is a really important topic. It's not woo-woo medicine, right? This is it's the true essence of our body's innate ability to heal. So can you tell us a little bit more about that?
Yeah. So this is like that, inner wisdom of the body that heals a trauma, for example. So if you break a bone, like you have a fracture, there's no medicine that you can get, right? Your body is going to fill in that space. Your immune system has an inflammatory response first. All of that is just this innate wisdom of nature, right? Yeah. And so it's really cool how we really emphasize that in naturopathic medicine, and a lot of the approaches we take are to support that vital healing. Yeah. What we're seeing, though, is that a lot of people, some of that is delayed, that there are things that impact that vital force. So things like environmental toxins, all the processed foods, it really does affect the vital force. And so another historical thing we've seen in naturopathic medicine is where kids normally, and everybody knows this, if a kid has a fracture or sprain, they're better really quickly, right? And then you take the 60-year-old version, and that healing is not very rapid, and it's delayed. And so a lot of that, there can be nutrient deficiencies, there's inflammation with age. But it's sort of, ultimately it's we're disconnected from our source, right? That vital force. And so much has happened over this lifetime, and stress and all of that gets us really disconnected. So I know we're going to talk about that a lot in these episodes.
Yeah, gosh. And that is naturopathic medicine. That's the essence, right? Of connecting back to that source, right? Our bodies know what to do. We just need to remove those obstacles and then support them. Yeah. So natural medicine, it's not a trend, it's a return, right? It's a remembering, a realignment with how we are designed to thrive and to heal. And we see this a lot in our medicine, right? We use herbs, plant medicine for this. Anything else you want to say on that?
Yeah, well, this is something a little bit, I'm kind of on a little bit of a soapbox about this lately. And it's just it's interesting, because it's what I've been observing is that, years ago, pre-pandemic, and I know we're going to have a show, I'll talk a lot about lessons from the pandemic, maybe talk a little bit about that if we have time here. But what I'm seeing, years ago, if someone was really sick and, they had a respiratory infection that wasn't getting any better, and then they are on antibiotics, and then they take prednisone, and they've got a pack that they take, then that would take care of it. And or even poison ivy, right? And now we have patients who they've done multiple rounds of antibiotics, they're taking prednisone, and it's just not even touching it. and then they come into us and we give them like gentle herbs, not even like the big guns, you know, in herbal medicine, and they're all better.
Right.
So it's like something is happening collectively with, I don't know, with our bodies that it's almost like we don't like resonate with like synthetic medicine anymore.
Exactly.
It's such like, I'm really trying to understand this. Like I see what's happening, and I'm really trying to understand ultimately like what's going on here on an energetic level.
I know, I am too. It's something I'm seeing in my practice a lot as well. And we want to be clear, we're not against conventional medicine. We absolutely need conventional medicine, right? For acute care, for diagnostics, right? For surgeries, absolutely. And we work, both of us work, you know, very integratively with conventional medicine. But yeah, I mean, you're right. Poison ivy is a really good example. I had a case a couple weeks ago where I had a patient who had a full body systemic reaction to poison ivy, which is really common around here. And yeah, gosh, you know, we need to use those herbs, right? People respond so much better to when we use those gentle herbs compared to just doing oral steroids. I think gut health is another great example. We will talk so much more about gut health, but for certain conditions where we might, you know, be used to using antibiotics that tend to knock out infections in the gut, we're just not seeing them work, right? I'll have patients do several rounds of antibiotics, but then they come to see me and I put them on herbs and they're better, you know, within a couple of weeks. And that's powerful, right? It's saying something about how, you know, the plants that we are surrounded with, and these are plants that are in our backyards, right?
I know.
And so, yeah, it's really powerful.
It is. It is really interesting. And right, like these plants were medicine. So historically, I was talking to one of our other doctors in our clinic, and these plants that we see in our environment around here in Connecticut that are weeds. Right, that we call weeds, are actually plants that were historically used as medicine. So they're not necessarily, like, they're not native plants, even though we call them native plants. A lot of these plants came from Europe and were brought as like the medicines that were actually used. So it's really, you know, a full circle moment, I think, and where natural medicine is right now. And I think it's something beautiful about with the pandemic that a lot of people like came to this realization and came to natural medicine, right? In that time where there weren't really good conventional options, right? There weren't good medicines.
Yeah. And, you know, we only have a couple minutes left here, but I think kind of transitioning quickly into talking about the pandemic, like you said, this was a turning point for our medicine. I think it was a wake-up call where people really said, like, oh my goodness, I need something more, right? And so this is the pandemic, while it was challenging and traumatic for so many of us, it did allow our medicine to shine. Have you been seeing that? Or do you think that as well?
Yeah, absolutely. And I mean, like economically, they have, you know, I know these numbers when patients, just not even patients, just like general public were initially just like, you couldn't even, we were having problems getting supplements into our clinic because like supplies were just really taxed, right? Because people were buying quercetin, they're buying zinc and all the things that we knew support immune function. And then people were very focused on, oh my gosh, I need to like support my immune system. And these were things that we've always used to support immune system, and like, why not use them then? And like, I don't want to get all political, but in the beginning, we weren't even allowed to say like, oh, you should take some zinc. You should take some quercetin or vitamin C. That was not even allowed, and people got like taken down like Facebook pages, and you know, it was a terrible thing. And then later, like government officials are out like saying like, oh yeah, I've been taking vitamin C and zinc, and I'm like, what? Oh my God, like why we could have helped so many people here, right?
It's interesting, right? I think the pandemic was one of the first times in medicine in our lifetimes where there was no algorithm, and conventional medicine runs strictly on algorithms, which again, not a bad thing. However, until you have something new come along where there is no algorithm, and that's where our medicine really shines, is we know how to use these plants. We know the mechanisms of action, right? How they work, how they target inflammation and immune function, and whether it's COVID or EBV or any other virus that might come along, not, you know, knock on wood, I hope not, but we'll know what to do because these medicines are they're far reaching, right? It's not just a specific algorithm. So that's where it really shone too.
Yeah, absolutely.
All right. Well, This was our first episode. Thanks, everybody. It was so nice to be a part of this. Jen, thanks for being here tonight and sharing all of your wisdom and knowledge with us.
Yeah, and thank you. This was just like amazing. And I know we have like so much to talk about. Like there's so many different things we can talk about.
Yeah.
I think, let's talk about what we're going to have in our next episode.
Yes.
What are we thinking?
Yep. Yeah. So our next episode is going to be all about long COVID and how naturopathic medicine is a part of that. And there's a lot to it. So stay tuned for that. Thanks for watching The Natural Doctors.
Until next time, stay curious, stay rooted, and awaken the wisdom within.
Nutmeg TV has been providing community television for over 30 years. We needed some studio upgrades, and Ion Bank believed in us. As a result of Ion Bank's financial help, we've been able to help others move on in a field that's difficult to get experience in. You're working with partners who understand who you are, and Ion Bank does that. They walk with us every day. It's community banking at its best.
Nick Augustino right here at the East Side Restaurant. We always have the complete full dinner menu. Knockwurst, bratwurst, sauerbraten, potato pancakes, red cabbage, rice pudding, cream pies, all the desserts that Germany had to offer. I always do something different. Yes, I do. I brought seafood to the beer garden at the East Side Restaurant. East Side Restaurant, your German destination restaurant in Connecticut. Tiki-taka, hoy, hoy, hoy!